Are you planning on having a platelet-rich plasma procedure done in the upcoming weeks or months? Has your doctor gone ahead and explained to you what you should do before or after the procedure in order to get the best possible benefit? Well, there are definitely things that you can do to boost the effectiveness of platelet-rich plasma and things that you can do after your injection to make sure you get the absolute maximum benefit possible. Hi there, I'm Dr. Stephen DeQuino, and I'm a sports medicine and regenerative medicine specialist at Revivify Restorative Medicine in San Diego, California. Today I'm going to explain to you things that you can do before a PRP injection in order to make sure you get the absolute maximum effect from it. So let's go ahead and review some of the things that you should or shouldn't be doing before a PRP injection. First thing is no NSAID drugs. That's non-steroidal anti-inflammatory drugs. NSAIDs are things like ibuprofen, Motrin, Advil, all of those are ibuprofen, naproxen or Aleve over the counter, aspirin. All of these have anti-inflammatory effects and anti-platelet effects. Well, if we're doing a procedure that relies on platelet function, probably not the best thing for us to do, going ahead and shutting down our platelets. So I usually tell my patients no NSAID drugs for at least 7 to 14 days prior to the procedure. Some doctors do more time, some doctors do less, but it's kind of up in the air. But the research that's out there usually puts things somewhere between 1 and 2 weeks prior. I also ask they do it 1 to 2 weeks after as well. However, NSAIDs in the class of COX-2 inhibitors, such as Celebrex or Mobic, can actually be used because they don't exhibit a lot of antiplatelet effect. The second thing is no steroids. Steroids are a step up from NSAIDs. NSAID stands for non-steroidal anti-inflammatory drugs. Steroids are simply steroidal anti-inflammatory drugs. So if somebody's getting a shot in their knee, their elbow, their wrist, their back of something like cortisone, of something like Kenalog, which is triamcinolone, Celestone, if they're taking hydrocortisone or other oral steroids, then you definitely want to go ahead and stop those about 4 weeks before any kind of procedure and after the procedure as well. Again, antiplatelet effects that might happen there. Third thing is no blood thinners, or at least decreasing the blood thinners. I'm very aware that there are people out there that can't come off blood thinners because of whatever the problem might be, whatever their condition is, that we don't want to do any harm. So don't take yourself off of blood thinners if you're being treated for something like AFib or cardiac conditions. Talk to your physician. See if there's anything that can be done. Can the blood thinners be held for a short period of time? Can they be decreased? Whatever you can do that might be able to decrease any of that antiplatelet effect that comes from those. Next thing, increasing water consumption. Drink a lot of water before your procedure. We know that somebody in a well-hydrated state has a better healing effect. And if we're relying on that healing in order to go ahead and help relieve whatever injury you might have, we want it to be at its best. So drink a lot of fluids. Also, it helps us to draw blood. If you want to be well hydrated, because then it makes those veins stand out better, we have an easier time doing the blood draw. You want to have a better diet for a short period and behind it. You should always have a better diet. All of us could always eat a little bit better, but things like an anti-inflammatory diet, such as a Mediterranean diet or DASH diet, we know that increased cholesterol, increased blood sugar inside your bloodstream can have an anti-healing effect or an antiplatelet effect. So it's always great to make sure that those things are as well controlled as they possibly can. We can actually see differences in your blood when we draw it if somebody has extremely high blood cholesterol. Control hypertension. If hypertension is out of control, your blood pressure, then people are going to heal less quickly. So we definitely want you to have your blood pressure under the best control possible. So make sure you're on your medications and taking them appropriately. Also, again, diet and exercise have a lot to do with that. Alcohol and tobacco are next. We've known for a long time excessive alcohol use can hinder our abilities to heal. It does affect platelets, and so does tobacco. Tobacco smoke is pro-inflammatory. It can cause problems. It can make your platelet count go down by degranulating platelets and causing more inflammation. Well, we want to control that. We don't want those platelets to open up before we put them where they need to be. So if you're using up those platelets due to some kind of inflammatory thing that you can control, such as tobacco, we definitely want you to control that. Stress. Stress can do a lot of things to us. And I'm never one to go ahead and blame stress for everything, but stress can have a lot of effects on our body. I always want to rule out other things first that we can find medically before I say, hey, stress has a lot, but it has a lot to do with almost everything. Stress is going to increase stress hormones. Cortisol, it's going to increase epinephrine, norepinephrine, and those things can definitely put stress upon your body. And when that occurs, your body's not going to be able to heal as well. Again, another thing that we know affects healing and that you can control. So do everything you can to get stress under control, both work stress, family stress, financial stress, whatever it might be. Increase exercise. Increased exercise causes a healing response. So if you can increase, especially aerobic type exercise for a week or so, even more, should be something we normally do, but if you can increase it before these procedures, it's definitely going to help out. And antibiotics. There are many antibiotics that can halt healing response. There's also a lot of antibiotics that are not good for things like ligaments or tendon healing. So if you're on an antibiotic, don't do the procedure while you're on an antibiotic. You should definitely be off the antibiotic for a week or two before doing any of these kind of procedures. There is, however, studies that are coming out that adding PRP to an antibiotic regimen to help with healing and things like skin wounds actually does have benefit. However, if you're already on an antibiotic and you're going into one of these procedures, it's always best to stop the antibiotic or finish the antibiotic, wait a few weeks before you do the procedure. So that's it, everybody. That's the top 10 things that you can do prior to a PRP injection in order to give you the best possible outcome. In our next video, we'll cover the things that you can do after an injection to give you the best outcome. But until then, thanks a lot for your time. Thanks for watching. I hope you got something from this video. If you are learning something and you find these of benefit, definitely like and subscribe, and we'll talk to you next time. All right, thanks again.